Good afternoon, ladies and gentlemen. I'm Murti Magdapane. In this session, I will present my presentation of our paper, me and my partner, my co-author, Muhammad Nanang Suprayogi. The title is Public Perception about the Implementation of Community Activity Restriction During the COVID-19 Pandemic in Indonesia. We both from the Bina Nusantara University. The introduction of our paper mentions about the society of Java and Bali have had entered a second phase of the quite scary situation in the pandemic era of coronavirus disease or COVID-19, or generally called as entering the second wave of pandemic. As a result of the second phase in Java and Bali, the second mass restriction has stipulated by the government of Indonesia to decrease the spread of the virus, especially in Java and Bali. The second mass restriction was called as Pemberlakuan Pembatasan Kegiatan Masyarakat or PPKM or Community Activity Restrictions. The PPKM policy was degraded into 4 levels. The first, the second, the third, and the fourth. The fourth level is the highest level of PPKM, and the strictest rules for the mass restriction is enforced. This mass restriction, of course, causes many social phenomena in Java and Bali to occur, especially in the fourth level as the highest level of the mass restrictions. The study focused on the social phenomena here have helped us to do this study about the anxiety perceptions caused by the mass restrictions and the benefit of the mass restrictions. The definition of lockdown effectiveness is for the mass restrictions as part of the lockdown. We also use the theory about the lockdown. So we wrote about the definition of lockdown and the lockdown effectiveness, and it is the ability to reduce the basic reproduction number, reduce the total incidence, and reduce the peak of hospitalization. Studies about lockdown also said that on social contact estimated that schools and daycare centers were the most socially dense locations compared with offices and homes. Still in the theoretical review, since we study about the perception of anxiety, so we wrote about the social anxiety here, and it defined as a sense that it's not easy, severity, and the fear of interacting in doing actualization. It is also considered as a social product, where anxiety is also driven by negative social views or evaluations attached to a person, the sufferer or of social anxiety. Perception in here can be defined as the process of attaining awareness or understanding of sensory information. Perception is also defined as a personal manifestation of how one views the world, which is colored by many sociocultural elements. This study used quantitative methods, and the data collection in this study was carried out online. We compiled research measurement tools on the Google Form application as the data collection tool. As we said, there were two indicators to measure, and they are the anxiety perception scale and the benefit of mass restriction scale section. After the data collection was done, the results of the questionnaires were processed using quantitative method and SPSS tool. The respondents chosen are the Society of Java and Bali Islands, amounted of 656 respondents, which varies in professions, ages, and salaries. For age, we chose 18 years old as the youngest. We can see here for the result. Here's the descriptive data of respondents. We chose mostly female. The number is 439, and the percentage is 66.9. And for the age, we chose the range of 36 to 50 year old for the most. And in this category, we got 295 respondents. So the percentage had reached the 45%. With the above 50 years old, we got 235 respondents, and the percentage reached 35.8. The interesting one, we also got the most 225 for people who got maximum 5 million rupiahs. They have reached the percentage of 34.3%, and here the rest. With this is the descriptive of research data after the SPSS process. In here, we got the restriction caused the decrease of educational quality of student. Here it is the highest, followed by cannot running the business optimally, and the next is restriction is not effective to decrease the spread of COVID-19. It is the descriptive data of the anxiety perception of mass restriction. So the respondents were quite scared about this kind of situation, the 15 kinds of situation. But we also got from the research, the respondents also aware of the benefit of the mass restriction. We can see here that for respect for health, we got 92.9% score. Also, the mass restriction, they felt that saving time because of work from home and etc. etc. We've got 15 benefits here, and the score is the scores are high. And here's the result of correlation. We got this, and from here, from the results, we can conclude that the results of the descriptive analysis showed that the average score of for anxiety perception of mass restriction was 36.25, while the average benefit of mass restriction was 42.97. This shows that despite their anxiety over the implementation of mass restriction, respondents have a positive view of the implementation of mass restriction. The correlation results show that there is a significant correlation between the level of anxiety perception of mass restriction and the level of benefit of mass restriction. The direction of the correlation is negative. In it can be stated that the higher the level of anxiety, the lower the level of benefit. And conversely, the lower the level of anxiety perception of mass restriction, the higher the level of benefit of mass restriction. And here are the recommendations we can give. Conducting outreach that the government program, which is the provision of mass restriction, is good to be implemented. Designing programs to minimize the negative impacts that occur due to mass restriction. Using influencers to spread the good things that need to be done to deliver programs is a good thing and an effective, a quite effective thing, we thought. And here are the references. And thank you for watching my presentation.